I would like to thank AIOS and EBI for giving me the opportunity to present in front of such an august gathering. I'm Rakhi Nathawat, Senior Manager, Eye Bank and Evaluations, Dr. Shroff Charity Eye Hospital, and I'm going to talk about training the next generation of eye bank professionals. So why training and development matters? We all know that, but it's good to revise again. Your processes becomes more efficient if the people are trained. They become more smoother in terms of eye donation, in tissue evaluation and distribution for transplantation. It's very important for quality assurance as skilled professionals maintain high standards in tissue processing and also the improved patient outcomes. So if you have trained professionals, the patient's outcome will definitely be improving. So in training, we basically in eye banking focus on 4 cadres. One is the eye bank recovery technician. The second is the eye donation counselor, corneal evaluation technicians, and the eye bank manager. Of course, then there are medical directors, volunteers, etc. But I'm going to focus more on the these four. What are the challenges in developing training programs for eye bankers? First is the diverse background. We are talking about the whole country. People coming from different educational backgrounds, different cultural backgrounds, and designing a training program that caters to this diversity and also ensures the uniform learning can be challenging sometimes. Also, it's a dynamic field. The eye banking practices keep evolving with the technology, with regulations, with research. 10 years back, who would have thought that we would have corneal evaluation technicians sign off to the transplantation of the corneas. So this field is constantly improving. The training programs must remain adaptable to these changes to keep professionals up to date. Eye bankers have a resource constraints, and we all understand that. Resources in terms of finances and human resources as well as infrastructure, which impacts the training. We have people who needs to be trained, but we don't have trainers who can train these people. Balancing the theoretical knowledge with practical training within resource constraint is also crucial. And of course, we have to have the cultural context in our training programs. Quality assurance, we have to maintain the consistent quality while we are delivering the training program, and again that's challenging because if we want to move towards a consistent training program, we need to have train the trainer programs first to maintain the uniformity and the consistency. Regular assessments, feedback mechanisms, and continuous improvements are essential, but again it's very challenging because once the people get trained, they hardly give any feedback or come back with any kind of questions also. Competency-based approach, we have to focus on competencies rather than just content. When we are talking about the recovery technicians, it should be what should be the competency of a recovery technician. The training program should cater to that competency. We have to identify the specific skills which are required for these cadres, and then of course the stakeholder engagement. It is not a one person's job or one organization's job. We have to involve people from different sectors, educators, eye bank professionals, administrators, even the policy makers to have a full-fledged training program. Of course, again, we have to balance the theory and the practice. It's more of like in the field work with the counselors, with the recovery technicians, we also need to have theoretical sessions as well. We have to look at some of the flexibility within the uniform standards, and again, and we have to ensure the long-term sustainability. Training is not a one-time work. We need to have more refreshers, and how do we sustain these training programs is also very challenging. Importance of the skill assessment tools in training. If we have skill assessment tools in a training program, it becomes very easy to uniform a training program because a skill assessment tool ensures the competency. It provides a structured framework for evaluating the proficiencies of trainees in specific tasks and procedures. Instead of saying that you are good and you are bad, we say, okay, you are good in these parameters or these skills, you have to improve on these skills and these parameters. This enables the trainers to objectively measure the knowledge, the abilities, and the competencies acquired by trainees during the training program. It also helps in identifying the strengths and the weaknesses of the trainees and how we track progress. So if we have done the training through the skill assessment tool, then we can track the progress after 3 months, with 6 months, how are they moving in those parameters where they were supposed to improve. So of course a regular assessment allows for tracking the progress, and it provides the valuable feedback for both the trainees as well as the trainers and allow them to monitor the improvement. It also ensures the standardization, promotes the accountability, and very important, it facilitates certification and accreditation, and I'm going to talk in a little later about the certification program by the iBank Association of India. It enhances the quality assurance by evaluating trainee performance against established standards. Skill assessment tools contribute to quality assurance in all the training programs. They help to identify areas where training programs may need refinement or enhancements to ensure the optimal outcomes. And if we incorporate these training tools, we can have more effective learning outcomes and better prepared professionals. And one such skill assessment tool developed is the rubric for assessment of iBank professionals for eye retrieval. This is again a step to standardize the retrieval process, was published in IGO in 2018. This is it's a very, very simple tool. Anyone can get trained on it, and then you can evaluate your recovery technician on these parameters. So this is the tool. Recently we have developed a new tool, which is the eye donation counselor skill assessment tool. Technician is more of a hard skill. You have to do it step by step. In the wet lab also you can do it, but for the counselors it is very important because it's more of a soft skill combination, knowledge, empathy, cultural sensitivity, etc. So this tool got published in January 2024 in IGO. I'm the first author for this, and this tool talks about all the skills which a counselor needs to have, starting from how do you initiate the case, how will your body language will be, empathy, knowledge, verbal and communication skills, flow of communications, etc. And it grades the counselor into a novice, a beginner, a competent, or an exemplary. If a person, while we are assessing the person, gets an exemplary in multiple places, that means this person can be a trainer for the eye donation counselors. So we can use the tool also to craft the career path for the counselors. What is the importance of certification? Like I talked about the eye donation counselors and recovery technicians. Certification serves as a validation of competence and proficiency in eye banking practice. It ensures the adherence to standardized protocols and ethical guidelines in tissue procurement, evaluation, and distribution. And it enhances the credibility and trust among stakeholders. Any recovery technician or a counselor or an evaluator, if they say, I am certified by an organization like iBank Association of India, it gives them a credibility and a trust in the stakeholders. And last year, for the first time in the history of iBanking, iBank Association of India started the Eye Recovery Technician Certification Program in the Banaras conference. 23 participants, the recovery technicians, enrolled themselves for the assessment. They were given a short training before the assessment, and then the trainers were trained by the master trainer. Before launching the certification, we had a webinar by EBI where more than 80 participants joined the webinar, and they learned about the tool on which they were going to be assessed. Out of the 23 participants who participated, only 16 were able to get the certificate. And all these 23 counselors were trained counselors for more than 5 years of experience or 10 years of experience. And we realized that once they were trained 10 years, 15 years back, there were no refreshers they attended. And when I was looking at the data, it was very disheartening that most of the people who failed actually failed in the first 2-3 steps of hand washing, gloving, etc., which are the basic steps for a recovery technician. So this is the initiative which EBI is going to continue in the next conference as well. But this time, before we move into the certification, these are some of the glimpses of the certification program. The first batch of candidates who got the certification at the conference. But this time, before we move to the conference assessment, we are going to launch a series of webinar through EBI where these people will be trained in each and every aspect of recovery before they go into a certification, and nothing will come as a surprise to anyone there. Training methodologies, we can have multiple training methodologies, classroom lectures, workshops, practical training sessions, simulation-based learning, OJTs, etc. But I think, Parihar sir, it's a request that if we can also plan to have e-learning modules for people who can go back and see again and again. Even we can have recorded webinars on YouTube, which people can access again and again to learn. So technology for training should be utilized more and more. At Shroff, we have a Jagat Singh iBank Training Academy, which caters to the need of the iBank professionals at all cadres, with the objective to provide the world-class training. From the beginning of 2021, we have trained 73 iBankers from multiple geographies, including South Africa. This is the core team of the Dr. Shroff Charity Eye Hospital who works on with the Jagat Singh iBank Training Academy. Thank you for giving me the opportunity to present today. And if anyone would like to know more about the EDC set tool for the assessment, please connect with me. Thank you so much. Thank you.
Thank you. Any questions before we close this session? Rakhi, if somebody from a distant iBank wants to get their technicians trained, how expensive is it going to be for them?
Sir, the fee for a recovery technician training program is 25,000 rupees. But it also, if the iBank is very small and they are not capable to pay, there are concessions available. Also, we are planning to have multiple workshops at different places where the people can come and get 2 days. It will be like a boot camp.
The regular 25,000 is a how many day?
It's a 10-day training program, sir.
So they have to stay in Delhi for 10 days?
For 10 days, yes.
You're planning to have 2-day sessions in
2 days,
smaller places?
Yeah, that I call as a boot camp,
yeah,
which will be like a capsule course. So where they will get all the necessary information, and then they can continue with their online training programs then.
They will not get a certification?
They will not get the certification is only through the EBI, sir.
Yeah, so that's a 10-day program.
Yeah.
Yeah.
No, EBI certification is in the venue during the conference.
During the conference.
No, I'm talking about, that is correct.
Yeah.
But at Shroff Eye,
that's it, yeah.
If say Rajasthan iBank or somebody sends a technician there, they stay for 10 days there and they pay 25,000. They will get an EBAI certificate.
They get the Dr. Shroff charity. Yeah, they get a Shroff charity.
Okay.
Yes, yeah, that's a totally valid certificate. And but the assessment and certification for
Can we
like
not
which
give the EBAI name to it if we are convinced that this is a good?
No. For that conference, the same.
We started last year, sir. Last year we started the.
Because government, this doesn't have any value to the government. So far, we cannot get a stamp from EBI. And
no, see, for example, our iBank in Mumbai is doing something similar. We have a training program for technicians, and then at the end of it, we take their exam, and then we give them a certificate from because as the HOTA Act says, we are allowed to self-certify.
Yes,
yeah. But I was just thinking if we can approve certain training programs under the EBI umbrella and give that stamp, it becomes an.
That we have started 2 days program and then we give certificate to the strength technicians.
This is for the new, not for the
No,
new
I'm talking about
technician.
brand new people whom we pick up from the field.
Exactly for them only.
For them, yeah. Okay.
Thank you.
Thank you, Rakhi.